My name's William Roberts. I go by Walt, though, and my specialty is internal medicine and pediatrics. So I'm from Georgia originally. Grew up outside Atlanta. Went to Clemson, which is where I met my wife. Went away for med school and then came back to the upstate for training, and this is where we decided to kind of have our family and put down roots. I can remember a time in med school, my daughter was still very young, and I was just starting on my clinical rotations in pediatrics and had the blessing of having had a wonderful pediatrician welcome us into the community there. And so as I was starting my clinical rotation through pediatrics, I just fell in love with it. I kept seeing my daughter in all of my patients, and that really helped make me passionate about pediatrics. And then fast forward 8 or 9 months later, and I'm finishing up my internal medicine rotation as a med student and just couldn't decide what I wanted to do. I loved it. It was intellectually stimulating. It was a whole different aspect of medicine. And so, I do what a lot of people do when they can't make up their minds. They choose both. And that's how I ended up where I am. The variety and the people. So the things that keep me interested in my work are the variety and the people. So I feel like I get the chance to do something different almost every patient visit. Even the boring stuff is interesting. I enjoy every aspect of it. I enjoy every aspect of what I get to do. And the relationships that I get to build, not just with individual patients, but with their families across generations, is really exciting. So I have an interest in newborn care, and especially in encouraging new young moms as they're trying to figure out breastfeeding and lactation. It was an area my family struggled with and went through challenges with. I've always felt that it was important to incorporate as part of my practice and make sure I learned a lot about it so that I knew how to help other moms out. My style of practice is really informed by a pretty simple principle, and that's if this patient was my wife or my daughter or my mom, my dad, how would I want the physician to be in that situation? What would I need from them? And thinking about that has kind of thinking about having that as my guiding principle has made it easier to build strong relationships with my patients where they have felt as much a part of the decision making as I am. Me and my wife, we love the upstate. When I decided that I was going to pursue a double specialty in internal medicine and pediatrics, we were surprised to learn that Greenville had a program, and we looked all over the country for training opportunities, but really the upstate has always felt like home, and it's always been close to family. And so it was kind of a natural choice from that standpoint. And more specifically, getting the chance to work in the Prisma health system, having trained here, I've gotten to know a lot of the providers and the specialists that you train with while you're here, and the quality is incredible. I trust the people that I'm working with and that I'm consulting with, and so it was a very easy decision to kind of stay in the upstate and stay with Prisma Health. Something most people don't know about me, if they meet me now, is that while I was at Clemson, I was an English major and worked at the Potbelly Deli. I don't know if anyone is familiar with Clemson or not, but that was my little Clemson claim to fame. And it wasn't until later that I decided that I wanted to pursue medicine. And my interests outside of work mainly revolve around my family. We're outdoors all the time when we can get the chance to be. And trying to keep up with my daughter while she reads. She's almost a better reader than I am at this point, and so that's become one of our hobbies lately, is trying to keep up with each other as reading different books. The piece of advice that I have given that patients have told me is the most valuable thing that they've heard me say is that I always encourage them, if you don't understand what I'm saying, ask questions. I will be more than happy to answer them. If you would like to make an appointment with me, you can do so by calling the number on this webpage.